Today we are performing ESTIM and massage on a football running back. He has a mid-belly biceps femoris hamstring strain. It's 2 weeks old and is still kind of painful, so we're going to start off with ESTIM for acute pain. IFC, carrier frequency of 4,000 with a pulse rate of 80 to 150 pulses per second. And first we're going to get an alcohol pad. We're going to wipe off and wipe away the dead skin where the plate electrodes are going to be placed. And then going to place the electrodes. And with this being a mid-belly strain, you want to try to get the injury in the center of this where it's going to get the most free. And then you're going to want to connect these across from each other in an X. Make sure the cables aren't being tugged at, that the electrodes are placed correctly. We're then going to make sure the machine's set up, which it is, and we're going to treat them for 15 minutes. It can be anywhere from 10 to 30. So we're going to start turning up the frequency, and she's going to tell me when she starts to feel it. Okay, and now it's going to be a pleasant tingling without contraction, so not uncomfortable. Right before it gets uncomfortable. Okay. Right there. All right. So we're gonna check. We're gonna start it. We're gonna do this for a little bit. Before this, we obviously made sure that she didn't have any implanted pacemaker, any heart disease, or anything like that. How does it feel right now?
Feels good.
Good. Awesome. All right. So for the sake of the video, we're gonna stop. We're going to unplug her. And then place the pads back on. Next, we're going to do massage. So for massage on a strain, you technically do not want to do it because it is a contraindication, because it can increase the inflammatory response and cause myositis ossificans, but it also is dependent on the athlete. So if it's still painful, you might want to just try a light effleurage. You might not even want to do any massage until it's not as painful. So what you're going to do is, I'm going to get some lotion. You're going to get a little bit because you don't need a lot. And then you're going to put it just on the area. And then you're just going to lightly massage. And this is obviously, you don't do this every time they want. You have to follow a protocol and treatment regimen. So just lightly effleurage for a good 5 minutes or until they feel better. And then you will clean her up. Make sure there's no excess lotion. And then they can go do their stretches or their workouts afterwards.